I noticed I am a pediatric cardiologist, and I always give an advice for the parents before they leave my office. And I tell them, make it sure that you turn off your phone or whatever at least 2 hours before you go to bed, so you allow your time to. And then the parents, they have this big smile on their face, and they say, see, he said it. I didn't say it. The doctor said it. It's like they are looking for support. It just gives you an impression how much these parents are struggling, and we are one of them. And my question to you, I'll start with myself first. You know, how can we control social media in our house? Is, you know, somebody said there is this software, somebody that said this software, in addition to talking to your children. But I think the power on all of us, including us ourselves, to stay connected with the social media is so much. How can we better control? Like, you know, I close it, instead of talking to them, they will have no social media anyway.
Yes, no, I think this is the $1 million question, right? And I don't think anyone has the right answer. I certainly don't have the right answer. Well, my reaction is that I don't think it's realistic to try to control. I don't think we can really control fully. It's out of our hands or control right now. I do think we can try to minimize risks, right? And again, I think the process that I think about is that, you know, the old conversations that we used to have or continue to have about drug use, about drunk driving, about unprotected sex, right? And we have to create the space and normalize the conversations around safety on social media. That for me is still pretty foreign, you know, as a parent, right? So I'm trying to get a little more comfortable as a provider, creating the spaces to make that as a, you know, a routine part of my conversations and anchoring. You know, but there are a few things, right? I think one is, again, is starting the conversation, creating the space, and it's really depending on the age. For example, when my kids were first introduced and they said, I want to have an Instagram account, and they were like 14 years old. I said, well, you can have an Instagram account at 14, but I have to follow you, right? So I have to see why you're getting. Right. So those are, you know, those were some of the conditions, for example, that, you know, parents can do. Yes, if you want to have a social media platform, I need to be able to have some contact and oversight. Now, but to your point, I don't think we can fully control. We can't be with the kids 24/7. We can't control the feed, you know, from platforms. However, I think more and more there might be some, I would say, availability and development of filters, right, in terms of content that we can try to put, you know, some of the guardrails. But I think the first step is actually to talk about the kids. We have to start somewhere.
Okay. So there is a question from the audience here. Any relation from Dr. Khalaf? Any relation with autism, and is there any effect on the mobile phone, you know, waves on our children, on ourselves as well?
So,
is there any link of social media to autism, or much screen time?
If the actual waves might have some effect. Yeah. No, it's a great question. I've heard about that question. I haven't seen any data. That's kind of, you know, substantiate that as evidence-based. But I have heard the question whether, in addition to the interaction, if the waves itself might have some, you know, effect in the brain. But I think the other thing, going back to social media, is that, you know, thinking about a spectrum, right? And there's a lot of kids that might fall into the spectrum that are actively interacting social media, and you can make a case that, you know, kids with pre-morbid vulnerabilities can be more susceptible, right? Kids with mental health conditions, kids with already poor self-esteem, and potentially kids with developmental disorders, right? And their ability, one, to interface, understand, but also because they're more often targeted, right? In terms of being targets of cyberbullying and so on and so forth.
Okay, the question that I think I said it first, they are asking, is there any link between screen time and the high number of autistic children that we see nowadays?
I have not, again, I have not seen, I think the honest answer is we don't know because we don't have enough data to prove or disprove. I think they are, the only data that I've seen, and again, on that spectrum is more related to ADHD. And, both in that the question whether kids with ADHD are more susceptible to become really, obsessed and hooked into social media in terms of their inability to shift the attention. But also there's some early studies that look at kids that did not have previously a diagnosis of ADHD, and a few years later, and correlating with the use of social media, seem to be showing some attentional issues. There was a statistically significant. So there is this question mark whether actually social media use could promote, the de novo appearance of ADHD-like brain reactivity.
Okay, thank you very much. There is a comment-like question here I see. It said, I wondered from the psychiatrist modality, in what ways can social media be used to promote the behavioral and the psychiatrist intervention and parent skills?
Yeah, if I understood the question well, I think that would fall into that, bucket of potential beneficial effects, right? If we really use the platform to provide education, healthy content, and if in a way reinforcing healthy behaviors, it can be a very, very powerful tool. I think the challenges that we have is that we don't control those platforms that tech companies do, and it's a business, right? So I think that's when, but hopefully society, policymakers, we can coalesce. But I think this is a great, great critical point, is really turning something that right now is concerning, potentially harmful, to actually helpful.
Okay. You mentioned from your talk that you said the government in New York have decided to invest billions in mental health. Can you tell me what kind of programs that you have in Columbia University and NYPD modalities to help these children with mental health? What are you doing exactly with this $1 billion, which we don't?
Yeah. So Governor Hochul, that replaced Andrew Cuomo, she has a great interest in mental health, and then launched about a month ago her, marquee mental health program at the state of New York, allocated $1 billion. Now, this $1 billion is going to be sliced and diced in many different ways, but a lot of it is going to go to supportive housing, in terms of addressing homeless and supportive housing and specialized services. And then, a lot of youth, mental health services as well. Now, Columbia already has pretty large and existent mental health network. So specifically for youth, we have, from community-based programs, we have, for example, we have providers that are embedded into primary care clinics. So they work very closely with primary care and pediatricians. We have clinicians that are embedded in 15 public elementary schools. So we see the kids at the school. So the therapists are at the school, and the psychiatrists do video telehealth for the medication management. And we have 3 psychiatrists that cover the 15 schools. We have a special needs clinic for youth, which basically treats kids with chronic medical and then psychiatric conditions. In the past with kids with HIV, if HIV became a chronic condition, we see a lot of kids with GI problems and neurological conditions. We see transplant kids, as well. And then we have specialized services, like we have a dialectical behavioral therapy intensive outpatient program that we treat high-risk adolescents with high risk for suicidality, self-injurious behaviors, We have a cognitive behavioral therapy clinic that focuses on anxiety and depression management using cognitive behavioral therapy. And then, of course, then we have the hospital-based services, emergency rooms and the consultation services. So it's kind of a mix and match of community-based and then, more specialized services.
I see here some question about the government. Of course, I think I can make some comment. I'm not really involved in the government decision in UAE, but I will say what I know, that the mental health have taken a very good step forward in UAE, and the government start pushing. One of the struggle that we have in mental health overall, not just on the media, is the funding or the coverage. So the UAE government has been pushing insurance company to cover, and in Abu Dhabi specifically right now there is most of the many patients has been covered by system like Fiqa, and recently they start applying this services inside the school where the therapists go to the school. So the psychiatrist or the psychologist, speech therapist, activation therapist can go inside the school, and that's already system in Abu Dhabi. I am not very much aware in Dubai how it is, but I know it's selected by school what kind of service they can have, what kind of service they cannot have. As for the social media, I believe it's still a struggle for us, and I'm not aware of the government controlling any special timing or special age against entering the social media or not. I really need to know about that. Okay, there is a question here, nice. How we can, with children, social media affect their talk and sharing in school? I think what they mean is the social media affecting their talk and their sharing in school.
Right. Yeah, no, I do think this is a community effort. And there's, if I understood the question well, I think there's different scenarios. One is, often we see cyberbullying, right, from students from the same school. And I think the parents should be encouraged, and the kids should be encouraged to tell the parents, and the parents should be encouraged to bring that back to school. And there's also kind of, the flip side, right, where we can use social media, and healthy behavior with social media and disseminate that through school and use the school as a platform. It goes back to having mental health in school. We need to bring the information, the resources where the kids are and normalize that. And the schools promote a significant platform for that. And I think, to your prior comment, Dr. Suleiman, in terms of the progress, and some of the developments of the mental health resources for kids, adolescents over there, I give you a lot of credit and your team, because I know you've been advocating for that, for a long time. So, congratulations.
Thank you. Thank you very much. I have another question here. How can we control outcome of student ability to create and imagine things that are not real, and stop them from making false stories? I don't know how we can really, how can we stop them? How can, they see it everywhere, so they will make stories. Some of them will be right, some of them will be wrong. I don't know if that's there is any way to control. What do you think?
Yeah, so the question is how we can stop fabricated content to get to the kids.
Yes.
Yeah, no, we can. That's at the one of the main issues for us right now is the unhealthy and potentially harmful content that is being pushed, all the fake news. And actually the research has learned that there are algorithms that actually promote racism, that actually you bring that to surface, right, very quickly, and kids are exposed now to hate content, right, even if that's not part of the cultural norm. So to your point, I don't think we can fully control. As long as they having exposure to social media, I don't think we can control, but we can try to at least minimize the risks, right, in putting as many guardrails as we can possibly be, using filters, using education and digital literacy, creating the spaces at home, working with the schools and work with other parents, right? So not easy. I'm not saying this is easy to do, right? But I think it's the best attempt that we have right now while more research and knowledge is developed.
All right, question from Dr. Agata. That's one of my good friends. I think everybody is my good friend anyway. But what she's saying, when should we start talking about screen time for parents and children? Should we start from the infant time and tell them what's the risk, what's the benefit, what's the all of this? Should it be part of our screening during regular pediatrician visit?
I think so, because I mean, I think we see so many toddlers already that the pacifier is the iPad, right? Is the screen time, right? And again, I'm not blaming the parents, because I've done it. Sometimes it's much easier. You need to do something. You just give an electronic, see your video here, right? And then when we try to take it away, it's challenging. So I do think it's a very good point. As we continue to learn information about not only about the content, but we also learn information that perhaps, time matters, and what might be those thresholds that we can inform the parents, right, in terms of, limiting exposure. But I think it has to start early, because kids are being exposed, to electronics and screens very, very, very early.
All right, I have, some question, I modify them as I understood them. But the question here is, what do you think about the artificial intelligence? What's the effect of this artificial intelligence on our social media issues, where everybody can make a lot of things without even doing any effort?
I know this has become a big topic here at Columbia. There's a whole task force looking to, AI in all sides. And I think, you can make an argument in either way, depending on, which side you are, whether this can be actually transforming the world for the better, or whether this can be actually, cataclysmic, the way some people say the AI can actually, have significant harmful effects. It's already going. There's a lot of AI built into these algorithms, in social media, and they continue to be developed. So I think it's a great point that it is built into the reality. But I think the jury is still out. I don't think anyone really knows what's going to be the end point. It is, for me, at least personally, is both. I have mixed feelings about the new frontiers and potential the AI can produce in terms of, in medicine, in healthcare, in education, as well. But also there is this other concerns that, have been raised. So I think we all kind of, looking at, how this is going to evolve.
Thank you very much. I think this will be my last question to you, as I think it's been almost 9 p.m. in our time. The question here, isn't using the social media affecting the child's skills in communication? Does it affect his ability to communicate?
Yeah. No, it is a great point. And I think we are seeing more and more that the way kids socialize online, of course, is very different than when you socialize offline. And it's helpful to think that it's not either or, right? That is still the belief is that we need to continue to promote and encourage offline social interactions. What we're seeing is that the more exposure to online interactions and the least exposure to offline, kids become more socially inadequate, more socially anxious. They don't know how to manage. They don't know how to read. Because if we think about it, it's a learning process. We're learning how to socialize and respond to visual cues and social nuances, right? Since we're little kids, and we grow in that, in socialization right, is arguably the main developmental milestone or task in adolescence. And if now we're really restricting, offline socialization because social media is taking over, all those milestones and social skills, in a way, they're slowed down, or we're getting to a halt. Right. So I think, I wouldn't say much in terms of, the language or the verbal communication, but certainly the social communication and ability to interact. I do believe it can be moderated and significantly impacted by social media.
Thank you very much, and really appreciate your help, Dr. Baptista. And there is a last question that just asking if they can share the presentation. The answer is yes, you can share it with your kids, with your friends, with social media, if Dr. Baptista will allow, and I'm asking him directly. Is that okay to share your presentation?
Yeah, of course, absolutely.
The last comment, I'm sorry, I wasn't going to ask you anymore, but the last comment asking, is there such thing that addiction, and is there a treatment?
Right. Yeah, no, it's a great point, because I think some of the research is saying that both the behavior as well as the potential structural changes in the brain seem very similar to what we see in patients and adults with addiction. Right. So there is the FOMO, right? The fear of missing out, that it's almost like psychological withdrawal. Right. And the apprehension and the distress, the agitation. So yes, I do think is a very pertinent question, that there's a lot of the behaviors and actually the interventions are very similar to, to addiction. So we're trying to use some of those behavioral models, to apply in terms of, moderating and limiting, online and social media exposure.
Okay, thank you very much, and really appreciate all the talk and appreciate all the audience. And I just want to tell that we have decided to switch to 8 p.m. for all our lectures. At the vote here is 52 against 22, 9 a.m. 22% or 29%. And at 8 p.m. it's 71%. So I think we'll switch to 8 p.m. for all our conferences. Thank you very much, Dr. Baptista. And
Thank you. Thank you for having me. A good night.
Thank you.